Do 6s on the posterior midline, below the spinous process of T11. Do 7s on the posterior midline, below the spinous process of T10. Do 9s on the posterior midline, below the spinous process of T7. Kidney 16 is half a sun lateral to the centre of the umbilicus. Kidney 17 is 0.5 sun lateral to the midline, 2 sun superior to the centre of the umbilicus at the level of Ren 10. Kidney 23 is in the fourth intercostal space, 2 sun lateral from the midline. Kidney 25 is in the second intercostal space, 2 sun lateral from the midline. Kidney 27 is just inferior to the inferior border of the clavicle. It's 2 sun lateral to the midline. Ren 12 is 4 sun superior to the centre of the umbilicus on the midline. Ren 13 is 5 sun superior to the centre of the umbilicus on the midline. Ren 14 is 6 sun superior to the centre of the umbilicus on the midline. Stomach 20 is 2 sun lateral to the midline, 5 sun superior to the centre of the umbilicus at the level of Ren 13. Stomach 21 is 2 sun lateral to the midline at the level of Ren 12, which is 4 sun superior to the centre of the umbilicus. Sanjiao 1 on the ulnar nail point of the fourth finger. Going to be feeling for the flare of the bone, looking at where the ulnar and proximal borders meet, looking at the nail bed, and putting my point in.
Pericardium 8 is found on the palmar aspect of the hand in this nice dip which is proximal to the junction of the heads of the second and third metacarpals. The point is just a little closer to the head of the third metacarpal.
Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpi ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in.
Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the first metatarsal. Feel along the inferior border of the first metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 cun proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4. Spleen 6 is located 3 cun superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle. It's in a tender depression. Stomach 36 is located approximately 13 cun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cun inferior to the inferior border of the patella. Stomach 37 is located 10 cun superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the breadth of your patient's finger, not your own. Stomach 39 is located 7 cun superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the width of the body's finger, not your own. This point therefore lies inferior and anterior to stomach 40. Stomach 42 is located on the dorsum of the foot between the 2nd and 3rd metatarsals and the cuneiform bones. It's approximately 1.5 cun proximal to stomach 43. In some people, when they point their foot and pull up their toes, a nice depression appears here. Liver 4 is located in a depression directly anterior to the prominence of the medial malleolus, but medial to the tendon of tibialis anterior. To bring this tendon into relief, dorsiflex the foot. So if you can relax. Don't confuse this point with spleen 5, which is much lower down. It's directly anterior to the prominence of the medial malleolus.